So remember, before they passed reform, they said the free market wasn't working. Let's look at what they've been calling free market. For any American to get access to health care at either a doctor or a hospital, one thing is required, and that's money. 50 years ago, when the HMOs and the PPOs, what most people call health insurance companies, took over the market, that was when the problem began. When Americans quit paying for their own health care, they became separated from their health care dollar. First in line is the employer. The employer chooses a health insurance policy based on premium. That premium determines copay, deductible, network of doctors and hospitals, as well as how the employee will be treated when they go to the doctor, but most importantly, how they'll be treated when they go to the hospital. Now, the employer gives his money to an insurance company. At this point, it's no longer the employee's money or the employer's money. The money is the insurance company's. Now, here's where a little formula I call the control power corollary comes in. Money plus control equals power. Remember that formula for later. Next in line are the people in the risk group. Now, the risk group, because it's a guarantee issue for employer groups, means that there are some people in there who are sick, very sick, and they drive up the cost for the entire group. Next are our friends in government. That's right, good old Uncle Sugar. Now, we've already discussed how the laws and the regulations have driven up the cost, but also political contributions and taxes and all of those things that go from the insurance company to the government. Oh, my Lord, do they drive up costs. And then there's the labor unions. Union workers inside the hospitals drive up health care costs, but also union mandates on all policies, including things like low copays and paying for medications and things like that, also greatly contribute to increased health insurance costs. Then government programs, social programs, Medicare and Medicaid. Reimbursements from your insurance policy have to go to make up for the underpayments in Medicare and Medicaid. Next comes big disease. These are nonprofits. These nonprofits put mandates on everyone's policy, so whether you have diabetes or heart disease or lung disease or kidney disease, your premiums reflect the fact that all of those things have to be covered for everyone. Next come our friends at the drug companies. Now, the drug companies have slipped themselves in between you and your healthcare dollar by marketing directly to you, encouraging you to self-diagnose and ask for their drugs by name. All of these people, all of these entities really get their hands on your healthcare dollar before you ever do. Not only do they control the money, however, most importantly, they control your care. Then once you get to your healthcare dollar, there are a few more entities between you and your care. The first is the attorneys. Now, these are tort attorneys who sort of sit right outside your doctor's office waiting for him to make a mistake. Now, malpractice insurance premiums are built into your doctor's cost of doing business, but also he has to run a lot of unnecessary tests just practicing CYA medicine. Also built into your doctor's cost of doing business is his business office, his billing and collections. Billing and collections wouldn't be necessary if it weren't for insurance companies. Billing department is necessary because not just one, but several pieces of paper have to be filed with the insurance company before your doctor can get that little dribble of money 90 to 120 days down the road that the insurance company gives him. Collections are there because claims are denied by insurance companies, and when they are, your doctor now has to go back and collect the money from you. All of these entities, all of these people are between you and a simple doctor visit. Now, equally intrusive and even more expensive are the ones between yourself and a hospital visit. First is claims. Far more claims are denied for hospital care because hospital care is far more expensive than a simple doctor visit. Now, the job of the claims department is to pay out as little as possible by delaying and denying. Now we come to the case managers. The case manager's job is to approve the least expensive treatment at the cheapest doctor. Said another way, what the case manager does is save the insurance company money by approving the least expensive possible care and finding the doctor who's the lowest bidder. And all of this begs the question, for whom are they saving all this money? It's certainly not coming back to you and I. Our premiums have increased 100% in the last 6 years. And it certainly doesn't go toward the doctors and hospitals or your care. The sad truth is that none of this money actually goes to where it should be spent. The money goes toward keeping this system alive. Remember, all of these entities take a little piece of your healthcare dollar. All of these entities control your care. Are you outraged yet?
There ought to be a law.
Not you again. So now here comes our politicians rushing to the rescue. And what they want to do is control the whole shooting match. We've devised a series of tools where the individual can take direct control of their healthcare dollar, going to any doctor that they choose. They can also go to any alternative practitioner they choose, and that doctor can actually control their medications. This is what we call healthy care. With our tools, healthy care is relatively inexpensive. Most doctor visits cost between $50 and $100. Chiropractic and other alternative care, less than $50. Most medications, again, less than $50. Many are as little as $4. When someone is seriously injured or gets seriously ill, that's what we call sick care. Now, sick care can be expensive. The average hospital bill is about $30,000. This is where we introduce a true insurance plan. A true insurance plan is what we call homeowners insurance, auto insurance, life insurance, the type of insurance that kicks in the event of a catastrophic financial loss. True insurance is set up to cover costs, not to control them. True insurance, in this case, would cover a hospitalization. Now, this true insurance policy we're calling a bucket of money. It allows you to choose the size of your bucket or how much money is in your bucket. These policies, as of right now, do not exist. Life insurance companies and property and casualty insurance companies will be the ones underwriting these. They need to assess all of their risk through actuaries. Once that's done, then they'll need to be approved by offices of insurance commissioner, but they're not that far away. Within a year, maybe a year and a half, these policies will be available to the general public. Remember, before the healthcare law passed, they told us that the free market didn't work. We, on the other hand, know that to be a lie. The free market does work when it's allowed to be free. Which of the two options looks more like free market to you? The system with the government right in the middle of everything? Or this much simpler system that is truly market-driven? You have a choice, America. You can choose the government system, or you can choose a system that will save you money and allow you to make your healthcare decisions.